I was walking down the hall on the 3rd floor, and I didn't know it at the time, but Skip was in room 309, and I was walking down the hall and I heard the infectious disease doctor say, well, we need to get this guy to the unit. And I work in critical care as the coordinator, so that piqued my interest, and I went to see what was going on. I first looked at the chart to see what diagnosis. I called the unit. I said, hey, we're getting someone from the 3rd floor. We need to hurry up and get the bed ready. Then I walked into his room and I took one look at him, and I recognized who it was, and I thought, oh my God, this guy is about ready to code right now. So I walked in. Skip wasn't breathing well. At first I thought he was having a stroke because he looked so bad. I saw his wife in the corner, and you know, you have to be kind of calm about the whole thing, but no, this is urgent. We got to get him to the unit right away. So we talked to the wife, said, we're going to the unit. We called respiratory, said, get an oxygen tank here now. And we basically unplugged the bed and went. We got him into critical care. We had to hook him up to all the monitors. We took his temperature. I think Skip's temperature was like 104, 105. He was chilling. He wasn't awake, wasn't talking. And then we realized, you know, this guy is septic. He needs some help. We just implemented our sepsis bundle, and I know the nephrologist hadn't had a whole lot of experience with it, and he was outside the room, and I said, hey, Dr. Sahi, we need to do this now. We need to give fluids, we need to give lactate, we need to get a line in him. He needs pressors. We threw BiPAP on him to help his breathing, and it all happened like within an hour. We had the sepsis line in, the fluids. We had him monitored. We had ice bags packed underneath his arms. We had a cooling blanket on him. And within about an hour, he was coming around. He was starting to wake up. He started to talk. He was pretty confused about what was going on, but he was back with us.
Just happened to be on the 3rd floor. I do various things in my job role here, and for whatever reason, I was on 3rd floor. I may have even been picking up patients for my students when, you know, Skip needed transfer to the unit. And whenever a patient goes bad like that, you know, all hands on board kind of a thing. And so I jumped in to help with the transfer and then simply stayed. My background's critical care, but it's been a long time since I've done critical care. And when I worked critical care, we didn't have the sepsis bundles. You know, we had certain protocols, but not near the guidance that these bundles give the nurses to care for the patients.
Found out that we had a patient come down from the floor. They actually told us it was Skip coming down with sepsis. Came down hypertensive, blood pressure was 60s or 70s, and his temp was like over 105. So the first thing we did is we iced him down and started the sepsis bundle on him, which is fluids and the sepsis catheter, and proceeded from there. Dumped lots of fluids in him and got his temp down and got him on pressors. Basically followed the sepsis bundle the whole way through. He got really scared, and I just reassured him that everything was going to be okay, and he just had to hang in there. And he says, I don't remember much, but I remember your face. Remember your face tell me it was going to be okay. And it turned out, you know, we got him under control and he was okay.
I looked in the bed and I saw Skip, who is a friend of mine, so my heart sunk, and I quickly found out that he looked like he had had a huge neurocatastrophe because he didn't recognize me. He was just sort of looking off into space, and the nurse who was up there was one of my critical care nurses who had kind of seen him go downhill so fast. His wife had just left, and he had just, we call it crash and burned, and knew right away he needed to go to the unit, that he was extremely sick. But we had no idea what we were dealing with at that point in time, other than it looked like a neurological catastrophe. He had some history that might have started the septic shock kind of coming in, and I was thinking about that in the elevator on the way down. We wheeled him into a room in CCU immediately. Everything was just perfect. We had an empty room, and we just started taking care of him kind of in a generic way, and we're all in shock because most of us knew him. And it became, with a little bit of history that was given to us, it became obvious immediately he was in septic shock and that he needed the immediate septic shock protocol started. and everybody there was aware of it. We had set that all up, and matter of fact, we were one of the front runners of getting that moving here. And the nurse that was caring for him down there also knew it. She had the table set up to put his CVP in before I knew what was going on. His entire body was covered with sterile drapes, and physicians were completely on board. It was really good because we all knew what we were doing.
I remember from an LDI in 2006 where sepsis was talked about, and I thought then, boy, would that be a terrible thing to happen for you to develop something like this, and a large percentage of those people who develop sepsis and go into shock, as I did, won't make it. And my understanding of the whole event, and I don't remember a lot of it, was that they immediately went into the protocol, the sepsis bundle as they call it, and started everything they needed to start to hopefully get me to survive this event. And I can't thank them enough. Every time I think about it, I get emotional. And they are really the ones that saved my life. The doctors came in later, but they are the ones that knew exactly what to do. And I cannot thank them enough. And one thing I would say is that I don't really remember a lot of things that happened. What I do remember is seeing a face, and later it was told me that it was the minister. And the face that I saw, I don't know if it was the minister or not. I do know that there was an extremely bright white light there. And I know that that light was God. And I know that He sent those angels, which were the nurses, to protect me, because I know that I was going the other way. So thanks to those ladies. Thanks for what they did for me. I think of them every day. And you know, as long as I live, they will always be in my thoughts for keeping me here for I don't know how long, but they are the true heroes here. The one thing that I could tell you and the members that are in the LDI is that from a clinical or a non-clinical aspect, the things that are taught at LDI are extremely important. When we go to these seminars, we need to pay attention to what is said, because what was said in 2006 truly affected me, and what is said in the next LDI can affect somebody other than me. So it's extremely important that we pay attention and that we get as much out of these conferences as we possibly can.